Good evening, and thank you for joining us tonight. We have the latest developments on COVID-19 in the Lubbock community. We will accept questions from media after the speakers, and to further social distancing, we'll have one person at the mic at a time, no standing in line. And I'll call you up to come do that. First, let's start with Catherine Wells.
Okay, I'll start again. Good evening. I just released our numbers for COVID-19 or coronavirus here in Lubbock County. We are currently at 31 individuals who are Lubbock County residents who have now been diagnosed with the disease. Today we received 8 new cases. This is the largest number of cases that we've received in one day, and many of these individuals are associated with a nursing home we found 2 positive employees on Wednesday, and we've been conducting additional investigations within that facility, and we have now identified additional cases of both one resident and multiple more employees. The health department's working very hard on working with that nursing facility to ensure that we have appropriate PPE and resources for that facility. Our goal is really to identify anybody that's positive in there, be able to isolate anybody's positive so we can reduce the spread to any of our residents. Those residents are really our most vulnerable, and as we're working towards trying to control and contain this disease, it's those older adults, people that would be in a nursing home, are really the ones that we want to protect during this outbreak. We currently are putting together plans to put in place a quarantine order on this facility, and this will limit movement of both patients and staff. Everybody will still be able to receive medical care, but we want to limit movement of patients out of the facility unless medical care is needed, and then we also want to limit movement of staff. We want that staff to stay working in that facility, not to be going and working in any other facilities, and we really want them to only go between work and home. And then the other 2 cases that weren't associated with the facility were a travel exposure and another exposure to a known case. We currently have about 90 tests pending in the laboratories, so we've really seen an increase in testing, and we expect to see those results over the next 2 days. Thank you.
Thank you, Catherine. I have one objective tonight that I want you to understand. This disease is very infectious. You can catch it easily as long as you're within a 6-foot bubble. My wingspan, or my distance between my hands, is roughly 6 feet. You don't need to be any closer to me than 6 feet. You have the right, and I have the right, to say, stop. You're in my bubble. You need to back off. I don't want what you have. Because we do have some asymptomatic carriers. We don't have enough tests to prove whether or not you're negative or positive if you have the disease. You must stay 6 feet away. And if you're at the grocery store, you're at the hardware store, I know that many of those facilities have limited access already and are doing their best to keep people away. And I'm also talking about people in my profession. If you go to a physician's office or a health provider's office, you need to stay 6 feet away from the next person. 6 feet away, that's what I want you to hear tonight. The wingspan of your arms for an adult. You need to stay 6 feet away. If you're sick, you do not need to leave your house. You need to be at home. I don't know how, I can't make that any more clear. You need to stay at home if you're sick. If you're partially sick, you still need to be at home. If you're taking care of somebody in your household, it's okay to help them as best you can. Give them what they need to make them feel better. Give them food, give them drink, but you don't need to be any closer to them. You need to be on the other side of the house if possible. Don't share any kind of dishes, drinkware, silverware. Wash their clothes for them but do it expeditiously, get in and out of the room and move on, okay? This is hard. These are hard things to hear for a loved one that doesn't feel good. But it's what's best so we don't spread the disease. As Catherine said tonight, we're going to put a quarantine order on that facility, and that's so we don't spread this disease any further. I'm already in talks with the mayor about what our next steps might be. And so we don't want to go there. Let's not spread this any further. We have plenty of sunshine. I don't want to paint such an ugly picture. There are plenty of parks to go to, but stay away from other people. We can still keep our social distancing. We have FaceTime. We have all kinds of other things. Zoom visits. Visit with your family that way for now. If we do this and take care of this, this will go away quicker. That's all I have. Thanks.
Good evening. I want to make a couple of sort of bigger picture kind of comments. First and foremost, on behalf of the City Council and city leadership, I want to reiterate how seriously we're taking this situation. I've spent some of my day today with citizens who believe this is blown out of proportion. And that's not my perspective. We will continue to make all of our decisions through the lens of what provides the best and most safe environment for our citizens. You've heard me say it over and over, but that's what this is about. I'm very thankful for the collaboration in our community. There's a lot of very good things going on as we respond to this virus. Look no further than the efforts to feed our kids and our senior adults to see those examples. I'm thankful for our hospitals. You may have seen the report this week in the Wall Street Journal that talked about, they basically listed us as, of the 300 healthcare markets they looked at in the country, we were very best prepared from a percentage of ICU beds compared to vulnerable population. Both UMC and Covenant remain strong and very much in business. We have plenty of ICU beds, and they have the ability to stand up extra beds, both hospitals, if needed. We are nowhere near that right now, okay? That's something you need to hear. We think there's about a handful of these Lubbock patients in inpatient care locally. You know, that changes throughout the day, but earlier in the day, that was the number that we were given. Remember that statewide, that less than 1 in 10 people that have been positively identified as having the virus are in the hospital. The vast majority of us, when we've had this, we're going to go to our room, as Dr. Cook said, we're going to eat chicken soup, we're going to drink Gatorade, we're not going to feel very good, we're probably going to be really upset because you can't watch a ball game, but we're going to do what you do when you have the flu. We're thankful for the testing that's going on in our community. That allows us to identify the people that are sick and get them away from those of us that are not. There is no reason to leave your home this weekend other than to go to the grocery store, and Lord knows we're doing that. I looked at some numbers today. We have data around traffic in different kinds of environments, and we're way up on our visits to the grocery store. We're way outside of our norms. Shop normally, please. There's no reason to leave your home this weekend other than if you have to go to work in an essential business. Stay home. Walk around the your neighborhood. Go to your park. Sit in your backyard. Play a board game. Please take this very, very seriously. Be safe, be kind, and be well. Thank you. Lacey?
Okay, Christy.
Thank you, Mayor. I don't know if this, okay, here we go. So I have a few questions, and the very first one.
Let's do one at a time so we can make sure we get
Okay.
everybody else, because we're
Okay,
probably
as
not
long
gonna
as we're
take up- yeah.
consistent.
Okay, just want to make sure.
At what number will the City of Lubbock consider a stay-at-home order?
So
I want to
let's
hear
talk
from
about-
you and
yeah.
from the doc.
We'll talk about stay at home. We'll both answer. We've just been talking about it. It's not about a number to me. Our order, if you look at our order, we've talked about this before, but let me remind people, our order is very much like the stay-at-home orders around the state without saying stay at home, okay? I think our people are smart enough to stay at home. If we say stay at home, the essential businesses are still open. I'm thankful that those essential businesses, particularly those retail establishments, your home improvement stores, even in our supermarkets, they have got, every day that goes by, they better understand this social distancing. They're working with their clients, their guests, to make sure that we're doing a better job of that. But it's not about a number. It is about making sure that we're providing best for the safety. And I'm going to rely very heavily on Dr. Cook and Ms. Wells.
Dr. Cook, will you answer that same question for me?
I
From
agree
a
with
medical
the mayor.
perspective.
I'm sorry?
From a medical
Oh,
perspective.
from a medical perspective. I agree with the mayor on this. You know, if we can stop, if we can really slow down this spread, it's a vicious virus. But if we can slow down this spread, I don't think we need to do anything different than what we're doing now. However, if it continues to spread and increase in numbers, and I know that I know the healthcare facilities, the hospitals in town are limiting their visitors and putting other things into place to help stop. This is a community effort in the healthcare industry. And I know that other businesses are making their effort to slow this down. We as citizens need to do our effort too and stop. It's worrisome. We're not there. It's worrisome. And we may need to do something. And the mayor and I and Catherine are in talk every day about this. So.
Thank you.
Mayor, I'll ask you first. And Dr. Cook, you may have to help answer this, but I want you to describe what it means, these patients that are associated. What does associated mean with Whisperwood? And is there any reason to believe that some of these people who've been infected and have a connection or associated with Whisperwood also had work or a reason to go to some other nursing home where another nursing home might also be infected?
Yes. It's very common for nursing staff in nursing homes to work for a staffing agency, and they may work at different nursing homes. We're very much in the middle of that investigation right now. That's why this quarantine order is, we believe, so important. But I think a simple answer to your question is yes.
And also, you said there are a handful of patients, a handful in patient care. Can you give us a number, how many people actually are hospitalized right now with COVID-19?
At one time today, there were 5 Lubbock County inpatient cases in our 2 hospitals.
Okay. And also, Dr. Cook talked about the bubble. And I respect that you guys have been so transparent about this with all these news conferences, but there is a little bit of a concern
Yes.
with us.
Yeah.
Our bubble's interacting here, and I wonder at what point could we go to teleconferencing for these news conferences so that we would not be infecting others potentially?
I think it's a great question. In fact, we spent time this afternoon working on 2 things along this, changing the way we do our meetings. we'll do a special city council meeting at some point next week. We've got to reconsider the order that's in place through next Friday. We plan to do that meeting virtually. Okay, we'll do that, and we can still do that and allow citizen input. The capabilities exist. We're making sure we do that because that's very important to us. Second, we're considering how to do the press conferences the same way. You know, we watch what goes on in Washington. There's horrible social distancing, frankly, on those press conferences. Mm-hmm. The governor's office has done his press conferences. They've done a much better job. However, it's difficult at times for them to keep you guys at a safe distance. So that's something that we are very much taking into consideration, and it's a great question. Thanks for asking it because I think it's important to us also.
Thank you.
Okay.
So quick question. We talked about obviously workers and if they're feeling sick, anybody that wants to answer, if they're feeling sick and that, doctors are telling them to come home, what happens if their workers saying they're going to be fired if they don't come in, even though the doctors are telling them to be quarantined? Is there a way to protect them if that does happen?
From a medically speaking standpoint, and the health authority, if you're sick, you need to go home. That's probably a human resources issue, and there's probably some kind of way that they can work around that, certainly through their human resources department, certainly.
Well, if it's like them, their workers being like, hey, if you don't come in, I'm going to fire you because you're not coming in, but they're saying, well, because you're not tested positive for COVID, but they're waiting for the results. Is there a way for the city or anybody to protect those workers? Because they're out of a job if they, either way, it's not a win-win for them, obviously.
Well, it's certainly not the city's job to tell private business what to do. We think if someone is sick, they don't need to be at work. We've tried to explain that to employers and workers alike. We suggest that employers get I call them the radar version of thermometers, and we're using them, as we talked about. We're using them in City Hall every day, and it's part of sometimes they're being used. Businesses are doing them twice a day. It's being used at the hospitals. There's not an employer in this town, I believe, that wants a sick worker at work. Okay, we're getting phone calls. You can't believe the calls we've had in our office this week. But bear with me. Okay. We've gotten phone calls, and we start digging in. We find that it's so-and-so's wife's friend that's calling for so-and-so. And, I can't do anything about that. All I can do is explain the seriousness of this. I would tell you that if you work for someone who wants you to come into work when you're sick, you may need to think about going to work for somebody else. That'd be my advice.
Yeah, we've just spoken with employees at Whisperwood who say that they were forced to come in or they were fired. So that was kind of where that came from. And I don't know if y'all were looking into that or not with the spread being so high.
We take the Whisperwood situation very seriously. The state will be involved in that also. They have the licensing function there. That's really all I can say. We can't comment any more on that investigation, but it is ongoing, and I can't underscore this importance of that investigation to us.
This is probably for Catherine or Dr. Cook. Can we get an update on how many tests have been done? We have 90 pending. It's my understanding that UMC has done 750-ish. Even an approximate number would be appreciated.
Right now, at least for the last 5 or 6 days, we've been hitting about 100 tests a day. So we're definitely approaching 1,000 to 1,200 for the entire time of this outbreak.
One more?
I'm going to answer a text question from another member of the media. There certainly are patients from outside of Lubbock that are in our hospitals, either as confirmed cases or as people that are under observation or investigation, waiting for a test result. I mentioned, I think, earlier in the week, but we at one point this week, we had cases under observation from as far away as Tucumcari. That is not unusual. That's sort of within our medical catchment area. And so there are those, but I think the message is that that's not a problem, okay? We got plenty of capability at both hospitals. So and getting you a number is very difficult on how many we actually have. And if I told you something now, it could very well change by the time our press conference finish. I think what's important, you know, is that we're in those having that communication, and it's not just me. It's me with those guys. It's medical professional to medical professional, and I'll let Dr. Cook comment on that too if you'd like to. If you want to add anything to that.
I think you answered it fine.
Okay, one more question?
With some of these cases are nearing the 2-week period, how does that be handled? Are they still being checked on to make sure they're no longer sick? And when do they get the chance to kind of come out of quarantine?
So for somebody that has tested positive for COVID, there's 2 different testing criteria or 2 different criteria we can use to evaluate that individual to say that they're no longer infectious, and that allows them to be released from quarantine. The first one is 2 COVID tests at least 24 hours apart that are both negative. The other one that we're going to use more often because we don't have as much testing capability is that the individual has been sick, or it's been at least 7 days since their diagnosis. They don't have any, and their symptoms have been resolved, and they have had no fever for at least 72 hours. And then those individuals that we have under quarantine will receive a letter from the health department that they can provide to their employer that says that they've been released.
Okay.
Okay, thank you. One more question, and then we're going to wrap. Okay.
Okay, so Dr. Cook said there's been a very serious vetting process, but he did say that you don't have that many tests. So how many tests do we still have in Lubbock County? I know that we've provided quite a few, and Catherine, this is probably a question that you can answer best. How many tests do we have, an ample amount for any citizen that has a need?
With the addition of the UMC clinic, which has now been operating for at least a week, that has really allowed the increase in testing capability to the community, and we are able to test those individuals that meet those requirements. But there are still requirements for being tested. You have to be symptomatic, have a fever, and then we can also allow people to get tested, especially if they've had an exposure to a positive case.
But we're not running out in Lubbock as far as tests.
We don't have an unlimited supply. There is a limited supply, but we've been able to test the ones we've needed to test thus far. We can't test somebody that doesn't need a test, that just drives up and wants a test.
Mm-hmm.
We have the capability currently to handle the ones we really need to test, but we don't have an unlimited
But
supply.
how many tests do we have left? And will they be
It
supplemented?
depends on the day. It truly depends on the day, because those individuals doing the testing for us get supplies on a daily basis.
But there's no need to panic because
No,
we
not
are
yet,
we
no.
have ample enough.
No, we have ample enough to handle what we need at the moment.
Thank
I
you.
will say that the hospitals, in preparation, you know, one of my jobs is to see what this may look like in a worst-case scenario. And let me just say that the Health Sciences Center and UMC and Covenant and the other hospitals are all talking to each other. Like Mayor Pope said, we've got a large number of ICU beds, we've got a large number of ventilators, but our catchment area is half the size of Texas and eastern New Mexico. So we don't want to go there. And so we have to do everything we can not to get there, and that's what I'm talking about, this social distancing sort of thing.
Thank you.
That concludes the press conference. I'll send out
Just
updates
real
this
quick,
weekend.
but we want to make sure that we set an expectation for next week about press conferences. You'll see daily updates from us as we've been doing. You should expect to hear from us a couple times a week, just with more in-depth kind of questions like we've done tonight. And we'll keep you posted as to when those will be. But that should be the expectation, whether they're live or via the technology that's been availed to us.